Yes.
Hello and welcome to Dr. Smita Naram. I'm so happy to introduce our 21-day Delicious Detox Challenge audience to Dr. Naram because she is one of the great Vaidyas, one of the great Ayurvedic masters of India. She is the co-founder of Ayushakti Ayurveda, and she is the current head of the Siddhaveda lineage, which brought forward for thousands of years some very specific, brilliant remedies and teachings about Ayurveda and how to heal the body, mind, and emotions through natural medicines. So I invited Dr. Smita here today to share with you just a few stories about how Ayurveda can really transform your health. So welcome, Dr. Smita. Thank you for taking the time to join us.
Thank you, and my pleasure. I'm so happy to be with you today.
Yeah, great. Can I start by just sharing my own story about meeting you, because it was pretty amazing to me. I had already been exposed to Ayurveda and I had spent time with one of the great Ayurvedic doctors. And yet the first time you took my pulse was really extraordinary. For those who are unfamiliar with Ayurveda, taking the pulse in a very particular way, and the Siddhaveda lineage has some very particular ideas about this, gives all kinds of insights about what's happening. So even though Dr. Smita had never read any paperwork about me and she did not know my life story or my health story, she said hello, she said namaste, she put her hand on my pulse, and she told me a few things that I already knew about, some imbalances in my health, like sleep disorder and some digestive problems and so forth. And then she said to me, I feel that you have a block in your right kidney. I would like you to go have an ultrasound. Let's check it out and make sure there's nothing that serious that needs to be addressed. So I thought that was pretty interesting. And I actually went that day. I was in India. I had an ultrasound, and the ultrasound did show a very small growth in my right kidney that is benign, and that they said needed to be, they need to keep an eye on. And I've had it checked every several years in the United States since. And it shows this slight kind of sludge and malfunction in my right kidney. And you found that in my pulse and knew that it needed to be addressed. So that is how specific just pulse analysis can be.
Yeah, absolutely. It comes from the masters. I've learned from them, and I'm practicing for years and years.
Yeah. So I was hoping you would tell us a couple of other stories. I know you have actually thousands of stories of really great healing that has happened, but tell us a couple of stories that have really caught your attention and even inspired you to keep going.
Yeah, actually, there's several such stories, but one of them was very, very striking. And this was the story which made me feel that it's so important to love yourself. Because when you love yourself, your heart is filled with love. And then you can give and spread love to the world. And when you spread love, you are flooded back with the love again, because it comes multifold back to you. So this woman, age 80, and I was actually working in Bern, which is the capital of Switzerland. And I was in the consultation room, and there's this woman which is entering the room dancing, literally 80 years of age. I know her for 7 years now already, because she's meeting me twice a year, each time I go there. And she comes with two papers in her hand. One was obviously looking report card from some hospital, and the other one was a letter handwritten by her. And she's coming dancing. Look, I made myself love me, and I won the battle. So, and just to tell you briefly what was happening with her was 7 years ago, she met me when she was 73 years of age. and she had this huge cancerous tumor in her stomach, small intestine, some part of the spleen, and the gallbladder, and everything was involved. Huge. And the doctor said that it's so huge, if we remove them, it will take out most of the part of your digestive system, and you will have to have the bag, and I don't know what. And she was so scared to have that kind of a situation, so she decided, I'm not going to touch it. That's it. And she came to see me. We started the treatment, and the diet and the detox and the herbal formulas and everything, and she did everything religiously. She was so religious. Quite impressed by that. And now she comes with dancing, and she says, look at my reports. 18 centimeter that I had 7 years ago is now 9 centimeter.
Wow.
So I was impressed. And she said, you know what? I wanted to show you this letter that I wrote to my cancer. And that was the inspiration to me. So she read the letter to me, and she wrote a very firm and a very strong letter to her cancer. And she's, dear tumor. She didn't say dear. She said, hey tumor, you are the unwanted guest in my body. And I love myself. So I'm going to do everything so that you will be shrunk. You will not be nourished. You will die out of starving, because you are growing, because I did junk food in the past. So it fed you. Now I'm going to eat everything right, so that you will have to starve and you will have to leave my body, because I love my body and I love this soul, the house of my soul. So, and you are unwanted guest, so you will leave. This was such a powerful message. And she did religiously everything. And she got the result. 80 years of age, she shrunk the fibroid, the tumor, and she lived, I think, until 87, 89.
Oh, really? Really? Really?
Completely on the herbs and the diet. And I think she stopped checking her tumor because it was shrinking, and she said, I don't want to give attention anymore.
That's a really wonderful validation, first of all, of her commitment to herself, to say, I love myself enough that I'm going to give up some of these comfort foods that was feeding this tumor, and then to fall in love with the diet and to follow the protocols and all of that. That is amazing. That's really a beautiful story.
Yeah, that's paying attention to yourself. It's like when you love somebody in your family and that person falls sick, you will pay full attention to that person, isn't it?
Right.
And you'll take care of that. But sometimes we ignore ourselves. We ignore to love us. We ignore to pay attention to what our body says.
Yeah.
And this is the chance to do it.
And I found this true for myself when you were saying that. I took such good care of my mother for so many years that I found that I wasn't taking care of myself the way I needed to. And
we all
now
do that.
that's my focus. That's my focus, is to.
Great. And it's radiating on your face. You have done something.
Yeah, I'm feeling much better. Yeah, that's great. Thank you for sharing that so much. And do you have another story to tell us before we go?
Yeah, absolutely. In fact, I was just thinking about, there are hundreds and thousands of stories, but this one is, again, it inspired me as well. So I've been going to Vienna for more than now, I guess, 15 years. Okay. And we have a couple of places where we have alliance partner clinics, like we have with Dr. Mitchell. Similar, I work with some other people in Vienna, and there's this very old student of mine who is a consultant there. And she had these two sisters who used to come to her and met her always there every time I went there. And these two sisters didn't speak English, and they were German speaking, completely never went out of Vienna. always traveled around Vienna with the family in a protected environment, housewives taking care of the family, very busy.
Mhm.
Around 62 years, the younger one, and the 65 was the elder one. And the elder one suffered from osteoarthritis, and it was very difficult for her to walk. She had to use the stick.
Mhm.
And I gave the herbs and the diet, and it definitely helped her. Definitely. She was earlier not able to do anything. Now she was doing everything in the house, and she was able to stand for almost 1 hour, but still there was pain. Still there was degeneration, obviously. And but it was 80% less. And the younger one had a very chronic neurodermatitis, which is like a severe itching and eczema and everything for more than 40 years.
Wow.
And she took the diet and the home remedy and everything, and she was like 80-90% out of the symptoms. So I just told them that, look, if you do a detox
Mhm.
coming to India, because now we have detox already in Vienna, but that time we didn't have it.
Yes.
So we have this clinic in Vienna who is doing full-fledged 3 weeks detox program like you started, but and she does the enema also in the clinic, and she herself is nurse, and then there are therapists. So, but we didn't have it that time. So I invited her to come to India, and I said, look, if we detox, which means we remove the blockages. So currently there are blockages in nourishing your bones, and that's why they stop degenerating. But we want to regenerate and reverse this
Uh,
whole degeneration, and that's possible only when you do this enemas with the oil.
uh,
So and for the sister, I said it's a very chronic health issue. If you do the detox, you will calm down your immune system and remove the heat, because every summer she get a lot of itching because of the heat in the atmosphere. So both of them never went out of Austria. No, don't speak any English. And I spoke to them, and they discussed, and I said, look, we will take care of you like a family. Don't worry. So something clicked, and they just came. Now it was a struggle, trust me, because they literally didn't speak English.
right.
And they never in their life ate those spices which we use, like cumin, coriander.
Right.
All of those
Right.
food was different. The treatment is different. We do the detox, which is a dramatic process and very difficult. So after 3 weeks were over, she was like literally 90% better further. So now she's able to sit down on the floor, which never happened in her life.
Wow. Ah,
And she's able to climb the steps without any support, almost 2 floors at a time, which never happened in the past. And she was walking at a time 1 hour, and this was like a remarkable change. And the younger one got a complete remission of all the skin eruptions totally. So when everything was over, I had a little meeting, and with great difficulty we communicated. So I said, how was it? Are you happy that you came? She said, ah, very hard, because she can't speak a whole sentence. Very tough, very hard, but very happy. I feel I love myself. She said, this is the love to me. The best gift I gave to me. She said with a broken English,
Yeah.
these 2 sentences. And I was thinking, my God, I had a goosebump, literally, because she could not speak English. So it must be so touching in her heart that she put effort. With the dictionary, she was looking for the words and forming the sentence to explain that it was hard, but the best gift I gave myself.
Yeah.
I think this was second best inspiring story I can say about a real experience of loving yourself.
I love that. And it's also great reinforcement about the whole protocol of the Ayurvedic detox, because what I'm hearing you say, it was the process of doing the bastis, the oil and medicated enemas, that helped pull the rest of the blockages out and then nourished the tissues in the bones. That was the great healing that happened for her. And I think it's so important for a lot of the people doing our detox programs will be over 50 years old. And so we're in the Vata stage of life when this is so important to really help regenerate the body and stay forever young, or at least younger, and really have a great quality of life for the remainder of our lives.
Yes.
Yeah,
Absolutely.
very good.
Wonderful.
Well, thank you for inspiring me. Thank you for sharing your time. And as we wrap up, what advice would you have to share with anyone doing this 3-week detox program, how to continue to support your health going forward without feeling like that you're constantly giving up, but to be able to embrace the abundance of delicious foods while you still continue with the Ayurvedic approach to sustaining vibrant health?
One thing is, of course, you have created this community, which is, I think, great, because you get always supported in the community when some other people are doing, and there's also you there who can guide and everything. So that's one thing which I'm sure is helping. But I think it's important that before we start such a dramatic detox program, which is very important for our health, we should be clear about what's our goal. Because if our point of summit, the top point is clear, and then you can and then they can make a plan with a milestone with somebody like expert like Dr. Mitchell,
right?
Who is their consultant. So they can create a milestone. For example, if you want to reach top of the mountain, you always create a milestone that, okay, it's going to take me 6 days of trekking. I'm giving example of trekking because I'm very passionate about trekking, and I do it quite often in the Himalayas. So when you do that, what we do is we have a plan. Okay, this many hours we'll walk on the first day, and then this is what we eat, and we sleep at night. Next day, this much we will do, and the day after this much. And there's a very systematic plan. So if you have a huge, everybody comes normally to Ayurveda or ancient healing only when it becomes chronic.
Yes.
Unfortunately, few people are preventive and they want to really take care of themselves in a way that they love themselves, so they want to stay healthy. But so you can always keep a goal first, then create a milestone with the consultant, your expert consultant, Dr. Mitchell. And then you will say, okay, in 21 days, this is what we will achieve. Then next 2 months, this is what we will achieve. Then next 2 months, this and this, then. For example, if somebody comes with a severe degeneration in the knee, cartilages are worn out, and they are recommended surgery, and they are afraid to do the surgery, and we have lots of hundreds and hundreds such files. So what we tell them that, and they are not able to walk, hardly, without any stick or support. Climbing the steps is out of question. Standing for long hours is impossible. And sitting down on the floor is not even imaginative.
Right.
That kind of a situation, we tell them that, okay, we start with the detox. And in the first detox, your inflammation, because detox removes inflammation. They always have inflammation. So inflammation will be gone. You will lose certain amount of weight because they all have huge weight, which is again creating load on their knees. Yeah. So losing weight and inflammation will be the first goal. And you will get 50 to 60% relief in your pain. So that's the milestone we set. But we do also a lot of treatment. So I believe this delicious detox is not involving a lot of treatments, but just the diet and certain cleansing through the herbs. So with the treatment, it's a bit faster, but you can set up the goal like that. So they are looking for that goal, and when that achieved, they feel, aha, it's possible. So create a small steps. Everybody should create that kind of a small steps and write it down in your diary. My journey, healing journey milestones,
Yeah.
and tick, done. First goal achieved, tick.
Great.
So just look at the first goal and see every day that you are going and reaching in that direction. Every day, reduction in the pain, reduction in the symptoms, weight loss every couple of days. These are the things which will keep you going.
Right.
So that's the way I think. And then you can set the next milestone and the next one and the next one. And finally tick mark everything. And then, okay, I'm going to reach there soon. And finally, after like 1 year or 1 year and 3 months of the whole program that we have, which includes even oil enemas in these degenerative situations,
Right.
thrice a week continuously, they actually see the change in their x-rays. So we tell them that, okay, after 8 months, we'll do the x-ray, then we'll do the next x-ray after 16 months. And that's the time we believe it should completely reverse, because that's what I've seen it happening.
So people who were scheduled or it was recommended to them to have a full knee replacement were able to regenerate their knees.
Yes, this research, and these case studies are published in a Journal of Orthopedic Surgeons USA.
Wow.
We send them all the reports with the procedure that we followed in those 16 months.
Yeah.
And we said this is what happened before and after, certain case studies, and they are very, very very stringy, and they ask so many questions, and they really don't publish unless they are convinced.
Yeah.
It's a peer-reviewed journal. So, and it was published there.
Wonderful. I'm going to have to get a copy of that to share with people.
Yes.
Well, thank you for your time today. And that was another really inspiring story.
Lovely to be with you.
Yeah, thank you very much. And we wish you all the best as we continue to share this great wisdom and knowledge of Ayurveda, as more and more people in the United States are learning to embrace this powerful, powerful path. Thank you.
Thank you.